In Nuevo Paraíso, Honduras, I met a little girl named Milagros. I was born and raised in Miami, yet I didn't speak any Spanish. Milagros didn't speak any English, yet we became inseparable anyway. We made friendship bracelets, pushed each other on swings, laughed at jokes neither of us could translate, because humanity doesn't need perfect words. It needs presence. We've all heard that icebreaker question. If you could have one superpower, what would it be? Some people might say flying, teleportation, mind reading. But my answer was always the same. I want to know every language in the whole world. Because I thought that language was the key to connection. If I could speak to anyone, anywhere, I'd be able to understand their lifestyle. And then, after a trip to a rural community in Nuevo Paraíso, Honduras, I realized something. I did learn a new language, but it wasn't Spanish. It was the language of humanity. Milagros taught me that connection isn't always built through vocabulary. Sometimes it's built through care, through attention, through being willing to give a part of yourself to someone you just met. But here's the part I didn't expect. That same trip didn't just teach me a new way to connect. It showed me a new kind of silence. The silence that happens when medicine isn't there. I volunteered and shadowed doctors at a local clinic, Clínica Santa Rosa de Lima. This clinic cares for the orphans and families from the surrounding villages, and it is the only clinic within a 2-hour radius. 2 hours. So when someone is sick, healthcare isn't just a decision, it's a journey. But what shocked me most was watching doctors turn patients away, not because the patient wasn't sick enough, but because the clinic didn't have the equipment needed to save them. And this isn't just one clinic story. The World Health Organization reports that in 2021, 4.5 billion people didn't have access to basic healthcare services. This means that 55% of the population can't take their crying child to the hospital. This means that 55% of the population doesn't have access to a basic clinic or doctor. This means that 55% of the population is left suffering from inaccessibility to medicine. These numbers seemed astronomical to me. How can 4.5 billion people live without access to a working operating room, without access to specialized doctors, without access to basic equipment? But that's what access really is. Access isn't whether medicine exists. Access is whether it reaches you, whether it's affordable, stocked, and accessible. Let me paint the contrast. When I had pneumonia, I was taken to a clean, inviting hospital in Miami. IVs, antibiotics, constant care. My family was never afraid I wouldn't survive. But elsewhere, UNICEF reports that 725,000 children under 5 die every year from pneumonia, deaths that are preventable. Why? Because 40% of children worldwide don't have access to the vaccine that could have saved them. Think about that. How many dreams, hopes, lives lost? Standing in that clinic in Honduras, I realized something that rearranged my view on healthcare. The opposite of access isn't just no medicine, it's indifference built into the system. A clinic with no equipment, prices that punish the sick, basic needs not met, and I kept thinking about Milagros. Because her and I didn't share a spoken language, but when we were kind to one another, we understood everything. Which made me wonder, what if humanity could act like a language globally, not as a charity that feels optional, but as a way of seeing and a way of responding? When people hear humanity, they often think big gestures. But humanity starts earlier than that. It starts with attention. It requires one simple task. Look closer. Look closer at what access really is, because the world doesn't need more medicine. The world needs more systems that deliver it. When I came home to Miami, I continued to work with the doctors I shadowed with in Honduras, and together, we set a concrete goal. Raise $50,000 for critical surgical equipment, incubators, anesthesia masks, hospital rolling beds, so that the clinic can strengthen care and expand what it's able to do. Because an operating room isn't just a room. It's a promise that these orphans can have a healthy future, a promise that emergencies don't automatically become tragedies. But I also realized that this is one clinic. So the question became, what do you do when the need is bigger than any one person? You translate. You translate heartbreak into action, numbers into names, pity into partnership. That's the language of humanity. So tonight, here's my challenge for you. Practice the language of humanity right here first. Connect with someone in this room with warmth and intention. Ask a genuine question and listen like the answer matters. Because if you can practice humanity face to face, you can practice it outward. I challenge you to use your hobbies like fishing and art to fundraise money. I challenge you to educate your community about inaccessibility to medicine by hosting guest speakers. That's the language of humanity. I started by wishing for a superpower, every language in the whole world. But Milagros taught me that the most powerful language isn't spoken. It's practiced, it's humanity. And when we speak it, through action, through care, through refusing to look away, we help to make healthcare from a gamble into a guarantee. Thank you.